Thank you very much for the introduction. Excellencies, distinguished speakers, and honorable viewers. I've been asked to give some observations from the neighboring country of Sweden, and I will be happy to do that. As you probably know, Norway and Sweden has taken different paths in how to fight the coronavirus. So I guess there will be a lot of it is a lot of discussions going on now. Who has done the right thing? But let me tell at this early stage that we don't really know the answers to this, but it is an interesting thing if you can put the word interesting into this strategy. I would like to start with a quote from our foreign minister. She said in the early of February this year at a security conference hosted by the Norwegian Atlantic Committee, and the theme was the Chinese challenge. She said that China is an indispensable partner. And I'm very happy for that because if you look to the media in Norway, and it's probably not only in Norway, but in general in the West, there is not much about the good help that is coming now from China. They don't talk so much about that. So, and not even the government, but I'm happy for this statement coming from the government. It is about, balancing things. So we will see how this approach. So I put this as a platform for the good work in the future. So let me give you some brief observations that the situation in Norway and how it is now. Well, we went to an early lockdown. We did that March 12. And the government, they came up with economical packages immediately to the companies involved and also to the employees involved. The government and the health authorities have been given consistent information throughout this 6-7 weeks. They are having a daily press conference together. And that I tell you, that is not in that Hollywood style we have seen from some other country. And this has also shown that there has been an extremely good cooperation between the health authorities and the government and the unions and the employees organization. We have the special three-party cooperation in Norway that makes things very steady. And as long as we are having a government, a minority government, the government has to go to the parliament with their decisions. And there has also been an extremely good cooperation between the government and the parliament. And also within the parliament, with the 9 parties we are having there, all the decisions that has been needed, and a lot of them, and some of them is about giving power to the government from the parliament because they need to do quick decisions. It has been unanimous. Norway is a country for the individuals, personal rights. But we have moved from me to we, from personal to community. The importance of protecting others, and by that you are protecting yourself, has been understood and accepted. As a matter of fact, we had a poll how people are, if they know the advice is coming from the authorities, and the three key things that has been put forward to the people how to behave, it got 100% rating. Our Prime Minister, Ms. Erna Solberg, she has been the lead person in this. And that was announced by, she was taken into CNN actually, at the Amanpour program. And she said in that interview 3 weeks ago that global problems has to be solved by global solutions. Verbally and financially, we are supporting the WHO. The university hospital in Oslo has been picked by the WHO to do a user research how to treat it. 47 countries are involved, and it's headed from Norway. We have sent a health team to Italy, to Lombardy 3 weeks ago. They came back yesterday. They are all healthy, and they did a brilliant job. Then we have the organization shortened for called CEPI, the Coalition of Epidemic Preparedness Innovations. It was an innovation taken by Norway in 2015, and in 2017 we founded this body together with Germany, the UK, EU, Japan, and the US. And also the Gates Foundation is in this. And this is strongly supported or partly a part of the WHO. And as they say, they prioritize a blueprint of diseases like MERS, SARS, Ebola, various fevers, and the COVID viruses, of course. And their mission is to accelerate the development of vaccines against emerging infectious diseases and enable equitable access to these vaccines for people during outbreaks. Last year, India joined, and hopefully China will join this year. So in practical terms, when the outbreak came in Wuhan, Norway were first engaged by trying to collect and send PPE to China. There were several organizations where the combination of the people was Chinese living in Norway and Norwegians trying to buy up and sell things to China. Actually, that was probably PPE things that had been produced in China. So there were several groups of people trying to send it to China. Some with success, some not, because the distributors, they early saw that we will need this soon ourselves, so we have nothing to sell. Then this was turned around, and then the pandemic came to us. And we needed then a lot of equipment. And we have got a lot of equipment through this Health Silk Road established by China. First was the Jack Ma and the Alibaba Foundation. Several full-loaded airplanes came in as a gift. We wanted to pay for that. That was not possible. So instead, we routed the money to the WHO. We have got lots of equipment from the Hunan province. It is a gift to Norway and to the hospital procurement office. So all that equipment goes out to the hospitals. We have also got aid sent from Shanghai to Oslo city. The city of Oslo is a sister city to Shanghai. And we have also, the city of Oslo also got 50,000 masks from the Huawei company. We are really happy for that. And there have also been other non-governmental shipments from various groups, and with combination of people, Chinese people living in Norway and Norwegians who have contacts with Chinese friends in China. Our foundation has also been partially involved in this. We tried first to find equipment in Norway to send. We didn't finalize that. We didn't get any. A couple of weeks ago, we were asked by a board member of our foundation who was involved in the packages coming from Norway and actually was helping out with some lockups to the city of Oslo to open that, to write a letter to Alibaba Foundation saying that we have contacts in Norway, because Norway we have a lot of organizations doing aid to a big part of the world, and maybe it will be useful for Alibaba to use some of these contacts in their future help. So a letter has been sent to Alibaba. Then I would like to mention a fantastic platform that China is offering all the world. It's called WeDoctor. WeDoctor Global Consultation and Prevention Center. This is an internet-based medical company coming out of Hangzhou, and they're using this technology to help anybody all over the world. There are free consultations, English-speaking doctors, and there's a manual for epidemic prevention, and even psychological assistance, and also a TCM, Chinese traditional medicine, guidance. It was launched in the mid of March, starting with approximately 6,000 doctors, 6,000 English-speaking doctors.
Mr. Vestby, can we consider the limit of time? Thank you.
All right, okay. So I would like to urge you to go to, you just Google WeDoctor, and there is a lot of help to find there. So finally, as Ambassador Gui said, the virus do not know any borders. Do not ask for any passport, your skin color, your last paycheck, your faith, or they don't even ask which football team you support. So when times get tough, it is important to pull together. The boat and the ocean metaphor are often used. So it is very important now in this stormy weather that we pull together, because we are all in the same boat and we are dependent on how we work together. On a personal level, but you might also say on a country level, prestige and lockups have to be thrown overboard. We in ICHI Foundation, we think that the WHO and the Health Silk Road are two concepts that are so important, and they need any support that is possible for the best of mankind. And I also thank BRICS for making this webinar possible. Thank you.